Hi Carl, my name is Charity. I am your nurse this afternoon. Sounds like Dr. Thornstein's gonna let you guys go home, huh?
Yeah.
Okay, and before he does, we're gonna have to go through the colostomy cares and what you need to do at home as for changing it and that kind of stuff, okay? And you are?
I'm Wanda.
Hi Wanda. Oh, hi Wanda, nice to meet you. So they've kind of told you a little bit about this and what to expect.
Yeah, a little
Okay, well we're gonna go through it and then as long as you're comfortable, sounds like we're gonna get you guys out of here.
bit. Okay.
All right, Carl? What we're gonna do here now is, I'm gonna expose you a little bit so we can see how your colostomy is looking, okay? I'm gonna teach you how to remove the old one and replace it with a new one. All right. All right, what I like to do, and one thing I'll let you know now is we have all the supplies that we're gonna send home with you, so you don't need anything extra.
Okay.
Everything that we send home is what you're gonna need. This is called just a Chex pad. What we'll do is just put it underneath the bag for when we remove it and stuff so we don't get messy. So that's, so here's your colostomy. And what you wanna do when you start to remove it is actually just start by the corners and just start peeling it back real slowly. Peel it all the way around. You'll see that's coming up real nicely here. All right, and what you wanna do is you wanna take it and you wanna throw it in the trash. I like to have garbage bags in my trash so I can just take the garbage bag out then and put a new one in. One thing with the stoma like this, Carl doesn't have control of when he's gonna go or when he's not gonna go. So I like to cover it with a towel while I'm getting everything prepared, okay? So once the old one's off, what we're gonna do is we're gonna actually clean the new one. We'll clean around it first, and then after that, we'll let it air dry while we're getting the size picked out and getting it cut and stuff. So you can either use a washcloth or these little 2x2s that will be sent home. And so what you want to do is just carefully wash all the way around the stoma. You're not going to hurt them. It's not painful for Carl. And what you're going to do too is you're going to start a diary or some type of a journal. And I want you to write down every 4th day when you change this what the skin looks like. Is it red? Is it whatever? This redness here, it almost looks bright.
Yeah.
That's normal. That's very normal for a stoma to look like that. One thing that Carl doesn't have any control is when he's going to go. So my thoughts to you would be, let's go ahead and change it like early in the morning when he doesn't have a full tummy.
Okay.
So less chance of having an erosion. So this is a measuring tool that we use, and this will tell you how big of the stoma you need to cut for the hole. So if you go ahead and you can measure it on him, clearly that is too big. You want as tight to the stoma as possible without actually touching it. One of the reasons why you do this is so that less risk of infection. Looks like they're ready to see how I got it just about flush almost,
Yeah.
barely skin showing. That's what you want to see. So the bacteria can't grow and also so that there's not breakdown of the skin. So once you have that, looks like 38 or 1.5 centimeters. Actually, it's millimeters, no, inches, 1.5 inches. Yes. So when you look at this, your new bag, what you're going to have is a circle and it's going to say 1.5. So then you need to go in with your scissors and you need to cut. And you start your cut and you follow it all the way around. Being careful that you don't cut through the bag on the other side. Okay, now we've got this cut. Got a nice hole here. I will then use an adhesive. So then what we would do is use the adhesive. You same thing, you go all the way around the stoma. Just like that. Let that dry for a couple minutes. And then this is just like a sticky backing. You just take this off. And what you're going to do is you're going to place it right over the stoma itself. See how there's just a nice fit there? You're just going to press and you're going to go work yourself all the way around, making sure it's sealed. You're going to continue to do that and keep working outward. Once it's sealed. Then these little clips that they have, and these can be reused for you guys. You will fold it in half over this end. Fold it in half like so. Bring it down and snap it shut. You'll hear a little snap. So there's the care there. If he has a lot of gas, this will blow up and get big. And what you can do is actually called burping it. So you can release this, work the air out, and then put it back on. I'm going to have you work this and make sure that you are able to release that and put it back on for me, so I know that you can do that.
Have some gloves.
What size would you like?
Large is good.
There you go. Quite the deal, huh, Carl? Good thing your wife's so helpful. Very good. And another thing too, when you see stool, you don't want the bag to be full. Maybe no more than half full. You want to change the bag and do the same thing by taking the clip off, and you can either dump it into the toilet, have them stand over the toilet, let it run out into there because it'll be pretty thin,
okay.
Or else just into a basin and then dump it into the toilet. Just wash off this end and put the clip back on.
Okay.
This should not cause him any pain, so that's good. So Carl, if anything hurts in your tummy, you got to make sure you let somebody know, okay? Because that's not normal. So yeah, then we just, once that's on, the clip's on, just remove this. Covered up here. Carl, I do have some instructions here for you. If any time, day or night, you guys have any issues, concerns, whatnot, I did put our phone number on top here.
Oh, good.
You can call us at any time. Doesn't matter what time of night it is. Don't feel bad. And this is just a little bit about a colostomy care and what you should know. Follow up your primary doctor. Skincare, you're going to change measure the stoma like once a week or so. Otherwise, the same size will probably be. But in about 8 weeks, it starts to shrink a little bit into the normal size that it's going to be. Okay. Change your pouch. So change Carl's pouch every 4th day. So Carl, every 4 days, you got to let your wife help you change your pouch, okay? And then also emptying it, like I said earlier, 1/3 to half full. You want to make sure it gets emptied so it could cause pressure on the seal and it would come off, and then you'd have a big mess or that kind of stuff. So then foods to eat. Healthy foods, fruits, vegetables, whole grain breads, low-fat dairy products, and lean meats. Don't eat anything that you think that may give you cramps or diarrhea. No chilies or that kind of stuff.
Oh, I like chili.
I know. Well, let's lay off for a little bit maybe, and then, or maybe just try a bite or two and see how it goes from. He's gonna know if it's gonna be very upsetting. As well as limiting foods that cause gas and odor, which then again would be chili, but also vegetables, broccoli, cabbage, cauliflower. Eat slowly, Carl, and don't drink your liquids through a straw. That helps, that intensifies gas. On the back here, it does talk about bathing or showering. You can go ahead and shower with or without the pouch on. It's okay to let the water run on it. It's not going to hurt anything. Sometimes that's kind of nice just to give it a little breather from the bag on there. Call your primary doctor if you have a foul smelling, fever, nausea, vomiting. You are going to have some type of smell because it's coming, but different than what you normally smell every 4th day when you change it. If you have any questions, give us a call, and then return to the emergency department if your bowel movements are black or bloody, as well as bleeding of the stoma that's unable to be stopped, too weak to stand up, or have severe abdominal pain. Those are the biggest concerns that you can have. I would give you this. I will go out and get a wheelchair, and we'll get you guys on your way. Do you have any other questions for me?
Nope, and I got your phone number, so that should be good.
All right, sounds great. Nice to meet you.
Nice to meet you,
Carl.